Hello, 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 everyone. It is PCOS Awareness Month, and I am so excited because momentarily we are going to be starting our first live of the month with some very special guests that we are waiting to arrive. Hi, Queen. Welcome to the live. Just waiting for the guests to get here. I have one guest already here. I'm going to invite Tatiana. Whoa, hello. Tatiana, if you could please request to join the live, and I don't know if Sandro is here yet, just request to join the live and then I can add you in. There you are.
There you are.
Hi guys.
How are you?
Yeah, sorry, just spending a bit more time in the makeup room. So, there's a lot of work that goes into this.
Actually, the lighting is perfect now. You got the lighting down. Both of you have the lighting perfect. You look wonderful. Gang, I don't know for whoever's watching from wherever you're watching from, but these two are actually across the pond in the UK and Ireland. So they're joining us worldwide. We're making this a real worldwide event, aren't we?
Yep.
We are bringing the family all over the world. So thank you so much for having us, Ashley. We're so excited to be here.
Well,
And you look amazing.
Oh, please. Thank you. Stop.
As always, you both look amazing.
Thank you.
Amigos. I'm so excited for us to be here together.
Yes, we are known as the Three Amigos. So today's IG Live will be brought to you by the Three Amigos and Fish Tacos after, right?
Oh yeah. Yeah. Yeah.
So let's talk a little bit about why we're here and who you both are, so everyone can get to know you a little bit. We are here today because I thought it was really important to talk about PCOS research. A lot of times as community members or as myself as a patient, I see a lot of studies that are posted, a lot of facts, figures, statistics, and my head wants to explode because I don't know how that relates to me or us or why I should care or why I should get involved. It's just like a lot of people talking and I don't understand why it's important. I mean, as an advocate, I know, but as a patient, it gets a little confusing. So I would love both of you to introduce yourselves and let everyone know how to pronounce your names because I really am very bad at it. And let them know what you do and then we'll dive into it a little bit and try to break down research for PCOS for patients. So Tatiana, why don't we start with you?
Sure. So my name is Tatiana Alafouzo. I am twofold, actually. I'm a PCOS patient and a PCOS researcher. So I was diagnosed 17 years ago. So my journey in many ways was very privileged because I was diagnosed very, very early in life at the age of 14. But at the same time, being a PCOS patient, I do know what it means to be, dismissed by your healthcare provider, and to have to fight for a diagnosis, and also the repercussions of having a diagnosis and what that means, and also the general sort of prescriptions that one is given as a PCOS patient. The general, here's some birth control, here's some metformin, come back to me when you want to get pregnant. And I sort of had a lot of difficulty wrapping my head around what it meant to have PCOS. And that led me down quite a destructive path of many different eating disorders throughout my adolescence and early adulthood. And really led me to wanting to help people with PCOS, which is kind of why I went into PCOS research. So I am an associate nutritionist here in the United Kingdom. I'm currently working on my PhD, which is focused on mindfulness-based interventions for people with polycystic ovary syndrome, and focused not just on the physiological symptoms, but also the psychological symptoms, which are very often dismissed, as we know, for those who have polycystic ovary syndrome. And so, yeah, that's kind of a bit about my story, and I will pass it on to Sandro.
Okay, so my name is Sandro Graca. I'm originally from Portugal and I live in Dublin, Ireland, hence the name. So a little bit of how I got into it all and my background, how I got into PCOS as well. So originally as a licensed acupuncturist, got really interested in what got me involved first was actually the reproductive side of it because of working with IVF clinics and having that acupuncture for IVF boom that happened, a few years ago, and which actually got me to, do a lot more studying in North America and knowing a lot of the people there too. I became a fellow of the ABORM, and the interest with research got me to a point where I started helping, and now I'm on the board as one of the directors of evidence-based acupuncture. So that's where I'm in that position where I'm kind of like in the two sides where I still deal with patients in one way, but a lot of my work, especially in the last few years, have been more to do with research, and that has been mainly because of really wanting to dive really deep into it and doing my master's degree, which was focused on acupuncture for PCOS. Now, luckily, out of that, I am luckily, and with a lot of hard work, I should praise myself for those years, as Tatiana knows. But I got one paper that was published out of the dissertation for the MSc, and yeah, it's been pretty cool because that paper is getting a lot of eyes, and luckily, it's been seen now as one of the papers, one of the most popular papers of the last 3 years for the journal. So it's good that acupuncturists are seeing this work, and obviously that will then translate into the clinics as well, and more support for people with PCOS. And I still keep like an eye on what's happening with reproduction as well. So I'm one of the researchers on the Cochrane review group for acupuncture for IVF. And I am in the middle of working. It's a small part, but everyone plays their part in the updates on the PCOS guidelines as well. So that will hopefully be out soon. We all know how important they were originally when they came out, and now everyone is working really hard. It's a huge and really awesome international team. So it's really exciting. And the reason why I love research, apart from obviously what I do and wanting to know more about what I do with acupuncture, is my goal is to bring that patient-centered aspect into it. And this is why I love being here with you both, because and following the work that you both do, and everyone in this, that advocacy for PCOS and for knowledge, is because really want to find out more about what matters to you. Why do you go for treatment? What are the outcomes that matter to you? And how can we serve you better? Like, how can we serve your interests? And just to add a little bit there, one of my main research heroes, like Professor Elizabeth Stenner-Victorin, which I got to lecture with last year, which is amazing. But it's all that work and research that first happens with animals, and then you kind of go, well, now I want to go into humans, and how can this help real people in the clinic? So that's like the aspect that I'm really interested into, is getting all that knowledge from research into the clinic and how it can help people.
That's awesome. So let's break this down a little bit, because there's some points that both of you talked about when we're talking about the patient. Research is really how things affect the patient, right? I mean, it helps us understand some of the nuances that we may miss, how people feel from day to day living with these syndromes, and how, as you were saying, Sandro, we can improve that quality of life and quality of care and transition that so doctors, clinicians, providers can better treat patients with PCOS. So Tatiana, as someone who is both a patient and researching it, from your perspective, why is understanding how conditions like PCOS affect patients so important?
Well, I think that, as Ashley, you know better than anyone, being an advocate for so long and knowing this syndrome inside out, PCOS is so complex and it's treated really almost like in the research to this day, despite the fact that it's been around, what, for 85 years, as Stein-Leventhal syndrome, as like a one-trick pony when it's not, right? Okay, how many papers are you reading that say women of reproductive age? Okay, so this is the issue that we are currently facing in the research, is that the big problem is the fact that the populations that are being researched for PCOS are too limited, in the fact that they are, and this is something Dr. Aziz talks about a lot, it's clinical populations, which is wonderful in the sense that, those are the populations that you have access to. So that's great because, we want research done. The fastest way to do it, the most effective way to do it, perhaps the most cost effective way, and, in any kind of way to do it, is to access people through a clinic, a hospital, whatever kind of population that you have. However, that population is always going to be, in a sense, a little bit biased, because you're always going to get the people who have been diagnosed. Okay, so we know that a ton of people are not diagnosed, right? 70% of people are not, so it's like, what about those people? Those poor people. B, it really is unfortunately, a syndrome of privilege in a lot of ways, because if you are diagnosed, because it means that you have access to doctors who have diagnosed you, which means that you probably have good health insurance. You have maybe, doctors who have, heard of PCOS or know about PCOS, or, things of that nature. Most likely you are white. And then also there's the whole, what about people who are not of reproductive age? That's the whole thing, is that, it's a lot of times those people who are in the clinic are looking to have a child. So that's why they're there in the first place, right? So they're, they're there because they are having trouble conceiving. This is how they get diagnosed in the first place. So then there's this whole other group of people. There's perimenopausal, postmenopausal, then there's adolescents, so it's like, all these other people who are suffering so badly, who are not in the research, and it's like, well, what about them? As we know, a lot of times when those people are even diagnosed, if they are even diagnosed, what are they told? They're told, not really the best advice in the world. If you are an adolescent, a lot of the time what you're told is, here's some birth control, here's some metformin, and come back to me when you want to get pregnant. Well, okay, that's not dealing with all the other symptoms that I have going on, which are, affecting my quality of life, as you say, on the day-to-day basis. And then for those who have, maybe past childbearing age, maybe somebody never even wanted children, that shouldn't even be in the conversation necessarily, unless somebody wants it to be. Then there's the whole, hysterectomy. That's not even it, because as we know, PCOS is a very complex disorder. It's not gynecological solely. It's endocrinological, it's psychological, it's affecting your entire body from head to toe. So the research should reflect that, and the research should reflect also the populations with that, so it should be different for each person, the way it is. For example, your symptoms are perhaps extremely different from my symptoms, are different from someone else's symptoms. And also that they could also be different depending on somebody's ethnic background. For example, a South Asian person perhaps could have completely different, thresholds for certain numbers in their blood counts, in their, in other things. Same for someone of African American descent. We shouldn't be like grouping everybody together. It's really is a spectrum disorder, and we really are treating it not as such in the literature. And so that's, I think, really kind of the direction we need to be going in the research. And I think we are, with the help of amazing, organizations like PCOS Challenge and amazing researchers, like Dr. Aziza and so on and so forth. But it is taking a lot of time. I mean, unfortunately, it's very painful, and it's moving very, very slowly. And I think that the more researchers we can get, the better, who are advocating for this and who are pushing for this, because we need to just, as much as possible, get diverse population that are reflective of our world. Those are the people who are reflective of PCOS. It's not, I meet people, when someone says, well, you don't look like someone who has PCOS, what does somebody who has PCOS look like? I mean, you know, I've seen everybody who have PCOS like run the gamut completely, you know? So I think that, I don't know if that answers your question or if I went off on a tangent over
No,
here,
no,
but
no. Actually, I'm so glad you did, because there's so much to unpack in that. I'm just going to make a few little key points, and I'm going to ask Sandra something. First of all, yes, there aren't that many new researchers that are getting involved in researching PCOS for a couple of reasons. First of all, the funding isn't there because for so long it's been looked at as gynecological, as, you know, simply reproductive, as something that's like a limited box, and it's not. And I think that's the biggest problem, is people don't understand how profoundly this impacts patients, and how diverse it is, and how, oh my God, statistically up to 26%, 1 in 5, it might even be 1 in 3 in some countries that have PCOS. I mean, that's huge. It's more than the amount of both men and women who have diabetes. And PCOS is a precursor to diabetes. So, I mean, why are we not researching it? Heart disease. Every month, every February, I do something for heart disease. You know, PCOS, if left untreated, could be a precursor to heart disease. Why aren't we researching this? So you're right. It has to be challenged. We have to make sure that all these populations are aware that there is research going on, and that they should be getting involved. Organizations like PCOS Challenge are trying to change this, and create ways for more patients to get involved, and create, you know, a funding for research, and advocating on PCOS Advocacy Day for the government to get involved and give more funding. Because right now, you ready for this? Okay. We get less. I know I say this all the time
no,
because it's
I'm happy
important.
you say it because it
It's
needs to be
important.
said.
We get less than 0.1. Again, hear me, less than 0.1% of government funding here in the US for PCOS research. There is something fundamentally wrong with that. So to transition over, Sandro, how do we take this message to clinicians and make them understand how much this research is needed, how people need to get involved in researching PCOS, and how doing that transitions into helping patients?
Well, you both know me well enough to know that I like to be a bit controversial at times, and here it is. The moment has arrived. I honestly, if you were to give me the choice between more research or actually having more voices heard, I would go with more voices heard. Here we are now talking about PCOS, and I find it very hard to convince me that more research is going to make a difference, because it's just thinking this way. If that was going to make a difference, do you not think that with the amount that we had in the last few years, that would have made a difference by now? I think, and again, I know it's coming to, you know, pulling things towards my passion of making this about the patient. But what about this sitting down with people that have the experience of living with it, and ask them, what can we do to help? What is not working here? How can we implement this stuff that is out there in research? Because look, ultimately, yeah, I'm a researcher. I want that money from funding, and I want to continue my career and all that. But I also want to make something that is meaningful and be part of, you know, it's like the work on the PCOS guidelines. You have to see that it is going to make a difference, going to be implemented, and it's going to help. Publishing more papers just for the sake of it, and particularly like Tatiana was saying, if the population is not a general sample of the population, how is more papers about PCOS in terms of pregnancy going to help the teenagers and early 20s being put on the pill because they have acne? You know, how is that going to help the people that might find it really difficult to lose weight because this is a metabolic condition, right? There's a lot of, you know, even with the psychological aspects, I would be very cautious with saying more research and just saying, can we just add that caveat, more research with the patients advising what we should be looking at? If you catch my drift, it's just, it's not just if you build it, they will come. We might be looking at something that the clinicians and the researchers are really excited about. This is like me doing a lecture about acupuncture. I love it. I'm really super interested, and I speak really fast when I'm doing it because I love it. But there could be people in the room that don't love it as much as I do, right? And it's a little bit like that. The geekiness that goes behind the scenes with the researcher and all the work that goes into it, ultimately that needs to be implemented. That needs to lead to outcomes for the patient. So what matters to you?
Okay, so if we're going to get controversial,
Let's go.
let's put this out there, because for a very long time I have said that we should create some sort of roundtable that involves researchers, clinicians, patients, but take it one step further, and I'm actually going to challenge a couple of organizations here. I think that when there are meetings of organizations like the Endocrine Society, like ASRM, like ACOG, that they should invite patient advocates and researchers and clinicians that are working together to present together. I would like to see that, and that's one thing that I think has been missing. Is I don't see that a lot with a lot of these conferences that are held and everything. And if you don't include that patient experience, how are you going to treat the patient or understand the patient? I don't know how you both feel about that, or if you could speak a little bit on that, but I'll leave it to both of you to respond to that.
Well, my research is very patient-centric. I know Sandro's is also very patient-centric, so we might be biased in this situation. But I believe that the patients are everything. I'm sorry. I don't think that your research is worth anything if you don't have your patients in mind. I agree with Sandro 100% when it comes to that. I think that for example, the NIH conference that was on cardiovascular disease and PCOS, the most clutching part of it was hearing you speak, hearing other PCOS patients speak, because the science is wonderful, but if there's no context behind it, it's almost, it's useful, but it's like the patients are everything. You're doing this for the patients. You're not doing it just to have the glory, like Sandro said. I don't care about papers. I care about patients. I care about their quality of life. I don't want someone to have to go through what I've gone through. You don't want someone to have to go through what you've gone through. You don't want your daughter to have to go through what she's gone, what you've gone through. You know what I'm saying? Like, we don't want future generations in 85 years to have to be sitting here doing this and talking about the exact same thing over and over and over again because nobody's moved, So for me and Sandro and you, I know, because we were all very good friends, in addition to being colleagues, that's the goal. It's not, who cares about the research if it's not moving anything forward? I mean, it's not about the glory of the research. I could care less about the glory of the research. I know that at the end of the day, that's what quote unquote supposedly gets funding. And in the end, we want the funding because why? We want the funding because hopefully we hope that the funding will get us solutions to the problem or move us towards some kind of a solution. We pray. So that's the goal. But if it's not for the patients, then who cares? And all medicine should be patient-centered. And I think that it's wonderful to include patients in anything, conferences, papers, interviews, anything. I think that is a wonderful idea, in my opinion, Ashley. And I think it's worth its weight in gold because, quite frankly, like, there is nothing like the patient experience. Nothing. You're never going to be able to get that from anything because no matter what your research tells you, like, it's it's at the end of the day, it's just science, but there's no emotions behind it. There's not somebody's lived experience behind it. There's not someone's like whole life that has been touched by this disorder behind it, you know? So there's nothing can tell you that except for someone's own personal journey. So I agree with you 100%. That's my personal view, and I know Sandro.
But I'll just add something there just quickly, Ashley. So I'll add 2 points. One, again, because you know me, and there's always the comedic factor when you meet me. But there's a good colleague of mine, Charlie Buck, is a great inspiration for me on both the practical and the research side. And he always says something about this aspect of science and doing things as science says, which is fine. And like we love it, and we're all here because of it, and we're totally for it. But having just that aspect of following all the guidelines and doing everything according to the book and according to the papers, Charlie says it's like having someone going for a big, huge, massive surgery, and then the surgeon coming out to the family and saying, wow, so the surgery was a huge success. We did everything by the book. We followed all the papers, and all the knowledge that we had was a huge success. And the family says, so when can we see the patient? And the doctor goes, well, unfortunately, the patient is dead, but the surgery was a big success. So it's this dichotomy between, yeah, we need to know that what we're doing is useful and it is what we should be doing, but we also need to know that it's for, you know, for what outcome. You know, my arm hurts, so I'm going to cut your arm off, therefore your arm doesn't hurt anymore. It's not, you know, we need to be a bit more practical here with how we address the patients. And I, again, you know, just not trying to sound too controversial, but I totally agree with Tatiana there in saying that researchers need the funding because that's what keeps us working. And we know that we may get another big opportunity next with the next funding. But in terms of, you know, you said it, like including the patients, like that NIH conference earlier in the year, like that was amazing. The experience of being there and actually hearing those voices was great. And it really brought me back to when I started to get really, really involved in PCOS. It was early days in my master's, and I was still looking at the reproductive side of things, not necessarily PCOS. And I went to, it was my first time at this big conference in Vancouver, and I knew Fiona McCullough off the internet and the book, and the patients loved the book and whatever. And I went to her lecture, not knowing her apart from online, sat at her lecture, and I was like, my mind was blown. I was like, this is amazing. And I got the courage to go and talk to her after. And I said, hey, got the book signed. And I said, the patients love the book. This is great. And you really, there's sparks in my brain here from the stuff that you were talking about, because this is 2016. And I was like, I find it really strange that we can have a condition that has 3 different criteria to be diagnosed. Like, how does this work and whatever? And I use this in my lectures. This is why I know that this is Fiona's quote. And Fiona said to me, well, I'm not really that interested in the diagnosis. I'm more interested in making my patients feel better. And
That's
I was like,
perfect.
that
Yeah.
is the seed in 2016 that got me into, maybe I'm looking at too much of this technical aspect and forgetting that maybe we should be asking the people.
You're right. We absolutely 100% should be asking the people. Because I'll kind of dovetail onto that a little bit. And I'm probably going to get killed for saying this, but it needs to be said. So, you know, I was at one of these conferences where I was on a panel talking, and the debate came up that PCOS isn't researched enough because of the name. And if we change the name of the condition, that's going to ensure that we get all of the funding and recognition that we need. And, you know, you were talking about the patient voice, and I kept saying, it isn't about a name change. It's about defining what PCOS is and how people are living with it. And you were right. Like, as a patient, nobody wanted to really listen to it, even though it was a valid point, because, you know, a lot of times I think as a patient or even an advocate, in some ways we're looked down upon by the research, by some of the research community, that we don't know enough. But as the two of you are saying, we probably know more than a lot of the researchers because we live with this. And I want researchers to know you can't invalidate that experience, that lived experience, because that's what you're really basing your research on all along. And it's not about the name of the condition. It's about the people. It's about the definition. It's about helping them understand what they're living with. I mean, I don't know. What do you both? You were both there for that, so I don't know what your opinion, or if you want to give an opinion on that. But I would love to hear your feedback on that.
Well, I'll just go first, just quickly, just to give you the kind of the view that I don't have the experience that you have as a patient and talking to other people in your community. I love to sit and listen because I think that it has made a huge difference for my work, both in the clinic and as a researcher. But a lot of the times, I say this when I'm lecturing as well in the college, and I say, one of the things that I hear the most in the clinic is, last week this happened with a new PCOS patient in the clinic. How come no one ever told me this? Now, this is the most frustrating thing that I get in anything that can come in through the clinic door is, I was never told this, or how come no one ever told me I have PCOS, or the typical, oh no, I did go to my doctor. And again, this is no disrespect about doctors or, MDs or general practitioners or gynecologists. I'm just giving you the experience from the clinic. And I went to my doctor, we looked at all the blood works and everything, and I don't have PCOS. And I'm like, I now know to ask the next question, which is, what does that mean to you and or your clinician? Does that mean that they looked at the ultrasound and they didn't see a multifollicular ovary? Or does that mean that there's other factors that they looked at and you definitely don't have PCOS? And to be honest, and again, this is just from my experience, the majority of the people that I get to work with, and it's a pleasure to work with these people coming into the clinic that either just found out or they're kind of in between getting the diagnosis, is because they are trying to get pregnant and they were told by their clinic, the IVF clinic or their clinician, that there's something going on. Their cycle is either irregular or there's something going on and they're not quite sure exactly what it is. And this just comes from the relationship that we have with the IVF clinics and some of those clinicians, and they go, you should go and get acupuncture because that normally helps with your menstrual cycle. And that's how everything then unfolds from there. So from my experience, what I see in the clinic is still a lot of the people coming in with or without a diagnosis are still coming in mainly because of trying to conceive. So to go back to what Tatiana was saying originally.
Right. No, it's a big deal because that goes back to what Tatiana was saying, that we're concentrating on women of reproductive age. A lot of websites, government websites, organization websites, provider websites, when they're talking about what is PCOS, you see the and it drives me, it's like nails on a chalkboard for me when I see the women of reproductive age. Okay, listen, I am post-hysterectomy, I am postmenopausal, I still have PCOS. And, I've had it since I was born. It started blossoming in my teen years where people were just telling me, oh, it's, just a part of growing up. Certainly in my 20s and 30s, that's when the reproduction came in because I was trying to get pregnant. But it's lifelong, and it evolves, it changes through those different periods of time, and care is just as important when you're going through reproductive age issues as it is for me being a postmenopausal woman. So it's important that we address those things. Tatiana, what are your thoughts? More thoughts. If I could talk today, that would be wonderful. What are additional thoughts that you have on this as far as how we come together, how researchers and patients better come together in understanding this dynamic and why we need each other?
Well, I think the more patient-centric research we can get, the better. You know, qualitative research is always like a great way, in my opinion, to get patient-centric research. Like my next study is going to be qualitative. I think that's like a wonderful, sorry, I'm just shifting myself a little bit. That's a wonderful way, I think, you know, because you're able to interview patients and to get the patient lived experience versus, you know, quantitative is just a bit more numbers based, which it's also wonderful. Don't get me wrong. They both have their strengths and they're both incredible. But sometimes that conversation with the patient is a really great way. But you know what I was just thinking, Ashley, is like, you know, when you go to a doctor, and I was actually thinking back to your, I was thinking back to your Discovery Channel mystery. What was it called? I'm so sorry.
No, it was Discovery
Mystery
Health
Diagnosis.
Channel Mystery
Yeah.
Diagnosis.
And I was thinking about, you know, it's like the doctor you remember the most is the one who listens to you, right? Like it may not be the doctor who is the best researcher or like the doctor who like even knows the most about your condition, right? Or it's like it may not even be the doctor who's like in the most like, you know, fanciest hospital or whatever, but it's like the doctor who paid attention to you, right? The doctor who like gave you the time of day, the doctor who really listened to your symptoms, who researched your case, who like really cared enough to like look into it, who like actually like took the time. And I think that that's just like what we need. You know, it's like whether that's in the clinical setting or in the research setting or in any kind of setting, is like we need just that kind of a rapport between patients and whether it's researchers or clinicians is exactly what Sandro is saying. Even for his clinical setting and the acupuncture kind of setting is like, you know, it's we just need more conversations. I think, quite frankly, where they occur or how they occur, whether they're in research form or whether they're conferences or whether they're in the office of your doctor's office. I just think we need more of that kind of like rapport to happen with patients, because the whole let's just keep going the way we're going and keep giving the same prescriptions we've been giving, or let's dismiss patients, or let's kind of like only like accept the PCOS symptoms that we know about is not really going well, like, you know, for anybody. So in my opinion, like it needs to be like a two-way street. I think that, you know, I think there are wonderful and amazing, you know, doctors and clinicians. Obviously, you've had experience with wonderful ones. You know, Dr. Sharif for you was like life changing. You know, so that was what I was thinking about for you. You know, it's like that's the doctor for you. That was like the life changing doctor. You know, it's like, so it's like, yeah, that's the one you'll always remember. You know, so it's like. We all need our Dr. Sharif in the sense, right? Like we all need that person who is going to do that kind of thing for us, be the life-changing kind of doctor for us. And whether that's like in the research setting or like the clinical setting, like we need somebody who's going to take our lived experience into account in order to be able to kind of help us, you
Yeah,
know.
definitely.
I don't know. I don't know if that's an unrealistic kind of like hope for the future, but that's my hope.
Oh, I don't think so, but yeah, I was actually going to transition that over to Sandra because I was going to ask you, like, what do you think we're doing right, and what would you like to see change to make a difference?
Well, that's a great question because I was just thinking about what has changed throughout the years since since when I started really paying attention to focusing on this particular aspect of PCOS in comparison to other conditions. And I'll be honest, the first thing that I was thinking about that is being done that is really, really good and has been a game changer is education. Like there is nothing that brightens my day more than getting someone in the clinic that actually knows a little bit about. And luckily, and I hope I keep going in this lucky streak that I'm having now, but I've had a nurse and a radiologist recently coming into the clinic, and kind of like early days of trying to finding out what was going on because something just wasn't quite right. And knowing that much and being able to go through the tests and do all the assessments was just brilliant. So patient education has been the big thing, because remember, linking with what you were asking about what could be done better, I think that it's that multidisciplinary approach, because it's complex, right? Like Tatiana said that in the very beginning, like it is a complex condition. So you're going to have really a team working together to help you, because there are going to be different aspects at play at the same time. And I think that that push and that knowledge by the patients to actually be the link between the clinicians, I think that that's amazing, because ultimately, the clinicians exist because of the patients, right? And like Tatiana said, there's good and bad professionals in every aspect of careers and life. So that it's just what it is. And those that really listen to the patient, and I can give you the example of when I started working in the fertility clinics, a lot of them would go, acupuncture in the middle of IVF? I'm not really sure about this. And others were like, well, tell me what you're doing and what you're able to do and how is this helping patients? And to be honest, the first time that I worked on site in a fertility clinic, it wasn't because of my great Portuguese tan. It wasn't because of my amazing knowledge. The main reason why I ended up doing that was because the patient said, why do I have to go from here to the acupuncture clinic? Why can't you just have them here? And you can ask a lot of other colleagues throughout the world where this happened as well. A lot of the times the push comes from the patient. So patient education has been amazing, and it's been the main thing that has really, really made me so happy in the clinic. And I hope that that will also help with what you asked, what is the next thing? I think that that aspect of multidisciplinary care, and the guidelines really push towards that, right? Like lifestyle advice, make it about the patient, inform them, educate them, and having that aspect of being multidisciplinary, I think that that's going to help, hopefully.
Absolutely. And you're right. I mean, because the guidelines, they have been, I guess, it's been almost, Sandro, like a year that this has been worked on, just about. It's been a
And
while.
let me just count my grays, and I'll tell you exactly how much. Yeah, the updates is probably, it's even longer than that. I would say probably you're touching at
Yeah.
about a year and a half now.
Yeah. Because I got involved in the early stages of it, and that was one of the things like that I love, and that speaks to what we're talking about is patient involvement. That I am actually starting to see that a little bit more when it comes to things like updating the guidelines for PCOS, and I'm hoping that we're going to start seeing more of this, because I also had another company reach out to me, to write patient perspectives for continuing education units, which are used for a lot of clinicians, a lot of different providers. So I think with the two of you kind of at the helm and reminding researchers to be patient focused, that this is going to continue, and we are going to see more multidisciplinary care. We are going to see more patient focused, centered research, and it's important. And organizations like PCOS Challenge are going to try to help bridge that gap between the clinicians, the researchers, and the patients. So I'm really excited about the future of PCOS research, and seeing what both of you will be up to moving forward. And I would love you both to tell everyone where they can find you, when they can bug you, and where you are on social media. So Sandro, go ahead and tell everybody where can we find you?
Well, it's really difficult to find me on social media because I am not very active and I'm a really quiet guy. I wasn't able to find all of you and being involved with all of you, so it's really difficult. No, it's I'll just plug, because I know that we all need loads of support, and the work that everyone does. Well, first of all, you, Ashley, like your work has been amazing, and I have to say, just like Tatiana said, sitting at that conference and hearing your voice was like, this is brilliant. We need more of this. But also with Tatiana's work and talking about qualitative work. Unfortunately, it's a little bit harder to publish qualitative research, but lately, for those that want to read, there's two papers coming out from Canada that were really, really interesting to get the views from people with PCOS. And as Tatiana was saying, like, that's a great way to listen to, and really, like, verbatim what those patients are saying about their experience. So yay for qualitative research as well. So to find me, yeah, look, online, sandro.graca is how you can find me, and on Instagram, Twitter and Facebook and all that sort of stuff. I am trying to bring back as much information on the YouTube channel as I can, but again, it's just how much I can stretch myself to put information out there. And with YouTube channel, really linking with all of this is really trying to make it talk more about how acupuncture actually would work for a patient with PCOS. Not how it would work, that it would work, but what to expect when you come to the clinic. So kind of break it down and linking, since I have like one foot in both sides, like with the clinic and with evidence-based acupuncture, to try and take it from the paper into the clinical reality, but using a language that the patients would understand as well. So I don't want to be talking too much technical stuff, and just going with, you come in and what happens and the questions that we might ask you. And yes, there will be something, related to blood work and scans and stuff like that, because some of us have done that training to understand that part as well. And yeah, for some of us who are lucky enough to be in that position, that multidisciplinary care as well, where we can say, hey, get in touch with your OBGYN and you get your scan or get your blood works, or, talk to someone about this, if there's any psychological issues as well. And then, I'll segue into Tatiana and going lifestyle advice. This is key. Lifestyle advice. We need your work, Tatiana.
Oh, thank you very much. Well, we need everyone's work, especially yours, Sandro. So you can find me, well, first of all, actually, I just want to say one thing very quickly. That Ashley was saying before, just because somebody is not a researcher or doesn't have a bunch of letters behind their name, that they should or should not be heard. 1 year ago, I put up my PCOS story on Instagram. I didn't expect anybody to read it at all. I was like new to Instagram. I didn't expect a single soul to read it. I tagged PCOSgurl. I didn't know her she didn't know me from Adam, literally. She had no idea who I was. And she changed my life completely in this community. She literally gave me a home, gave me a place, and gave me a voice, which I didn't think I ever would have. It was one of the scariest things that I ever did in my life. I never had vocalized a lot of those things, even to the closest people in my life. And it was incredibly scary. So please don't ever think that because you're not a researcher, or that because you are not a clinician, that your voice and your story do not matter. They matter more than anyone, because you have the lived PCOS experience. And Ashley is the most amazing advocate anybody could ask for. She has amplified our voices more than anyone has ever. I've never seen an advocate like her. She's just fearless and amazing and incredible. So I'm so incredibly grateful for you, Ashley. Thank you so much for all you do. I know that you're quote unquote retired, but I am just beyond incredibly grateful for you. So thank you for having us, and thank you for everything that you do.
Thank you. And this is how my retirement is going for me.
It's really quiet, apparently. Yeah. So
I can't stay away. So.
Yeah. So you can find me on Instagram. I'm PCOS PhD. You can find me on Twitter. It's my name, Tatiana Alafouzo. It's pretty much where I hang out. See, Tuckman's Graham says, agreed, PCOSgurl, you're the best. I agree. You can find me on Twitter as well. I mostly hang out on Instagram though, and my DMs are always open, so you can write to me anytime. I'm pretty friendly. I think Ashley and Sandra will agree.
I want to have margaritas with you guys after this is all done.
Yes, absolutely. And thank you all so
amazing.
much for being
this
here
has
with
gone
us.
from tacos. This has gone from tacos to margaritas. I'm loving this
Apparently.
conversation. It's amazing.
Ahead, But no, thank you both so much for taking the time to spend Sunday evening with me and help educate the community. I truly, I know a lot of people say this, but I truly mean this. I love both of you so much, just because of your commitment to this space and to the patients, and you know, really literally investing your time and your lives into making our lives better. So thank you to both of you for that. And you know, I hope we'll be doing this again soon, because I loved it, and it was great for people to understand why they need to get involved, how they can get involved, and most importantly, that, as both of you said, the patient experience matters, the patient voice matters. Throughout PCOS Awareness Month, gang, I'm taking a step back from my big mouth, and I am basically giving my feed over to anyone and everyone who wants to share your story, because I always say the first step to advocacy and being an advocate is just telling your story. So come tell your story. Please tag me, and you know, there's going to be a flood, but I am going to try to repost as many people's stories as possible, because as you both said, that's where we learn the most. So please do that, gang. Love to you both. Have a wonderful thank you. Have a wonderful Sunday evening, and this will be up on my feed. And oh, one reminder, I do have a fundraising button at the bottom for whoever watches this. It's important to also donate and support, because PCOS Challenge works on advocacy days, which help the government understand why we need funding, and they also help new researchers and existing researchers with the research as well. So please consider supporting them so they can support research and the future for everyone with PCOS. Once again, thank you, Tatiana. Thank you, Sandro. And I will be talking to both of you both very, very soon.
Thank
Have a
you.
great night.
Bye.
Bye, everyone.